Now 12:30, so we will begin. Thank you so much for joining this afternoon's Geriatric Knowledge Mobilization Rounds webinar. My name is Jenny Seaman, and I'm the Director of the Regional Geriatric Program Central, and I'm pleased to moderate today's session. We wish to begin first with a land acknowledgement. We do understand that a land acknowledgement is just one part of our ongoing commitment to truth, reconciliation, and decolonization. I'm currently located on the traditional territories of the Mississaugas, Haudenosaunee, and Anishinaabe within the lands protected by the Dish with One Spoon Wampum Agreement. We have guests joining us today from across the province, so I encourage all of you to reflect on the territories upon which you live, work, and play. I next want to take a moment to wish all of the nurses attending today's webinar a very happy nursing week. Your commitment to care makes a lasting impact every day, so thank you so much for all that you do. Today's webinar covers a very exciting topic, and it is called Continence Matters, Managing Urinary Incontinence in Older Adults. This will be a very informative and practical session. This is a joint offering representing a partnership between the Regional Geriatric Program Central and the Gera Center for Aging Research, and the excitement and enthusiasm on this subject has been so wonderful, with over 100 registrants for today's session. From a quick housekeeping perspective, we are meeting today via a Zoom webinar, so as guests, your cameras and microphones will be muted, and we invite you to participate through the Q&A and chat functions that are visible at the bottom of your screen. Following the webinar, we will distribute a survey link to you through email. It allows us to collect feedback about what you would like to see, and it will take no more than 3 minutes of your time to complete. With that, I am very thrilled to present and introduce today's speaker, Dr. Melissa Northwood. Dr. Melissa Northwood is an assistant professor in the School of Nursing at McMaster University, teaching in the undergraduate program. She conducts collaborative research through partnerships with older adults and healthcare providers, social care providers as well, to improve the well-being of older adults and enhance the culture of the practice environment, and also fostering health system integration. Prior to joining the School of Nursing in 2020, Melissa had a lengthy practice career across healthcare sectors, most recently as a nurse continence advisor with home care. With that, I am pleased to hand it over to Dr. Melissa Northwood. Thank you.
Thank you, Jenny. I'll just get my slides teed up and get started. Okay. How does that look on your end?
We are seeing the presenter. That's perfect. Thank you.
Oh, it's the right view? Okay.
It's the right one. Thanks.
Super. Thank you. Thank you so much for inviting me to talk in your webinar series about Continence Matters and Managing Urinary Incontinence in Older Adults. And happy Nursing Week to all of the nurses out there too. So for my talk today, I wanted to discuss some of the contributing factors to urinary incontinence in older adults, some strategies we can use to promote continence that we know from best practice guidelines, the research, and also clinical practice, and then highlight some resources that can support you in your care of older adults. And of course, we'll have time for discussion at the end and to take your questions. So I'll just start with some background about urinary incontinence, which is the involuntary loss of urine. And it's estimated to affect between 25 to 45% of women, 40% of men, up to 40%, and anywhere between 50 to 75% of residents in long-term care homes. And the reason for this wide variation in prevalence is due to the different ways incontinence is defined and then measured and then reported in the literature. So, but as you can see, it's a very common problem for adults across the lifespan. And why this matters is that urinary incontinence has a significant negative impact on people's quality of life, even their mental health, their sense of self and self-concept, and incontinence and finances, which is usually in terms of purchasing products and doing extra laundry. Incontinence in older adults is also associated with falls and fractures, can create skin breakdown as well, and it can cause challenges for care partners or family caregivers who are supporting older adults. So, despite how common urinary incontinence is, many people do not share that they're living with this problem or even reach out for help. And I think this is maybe in part because of some of the myths that still exist that incontinence is a normal part of aging, or it's something that you have to put up with as you get older, or that people are embarrassed to seek help. This quote here, patch it in pads, is a quote from a participant in a qualitative study I did about the experiences of older adults receiving home care and managing their incontinence. And this kind of reflected her and other participants' resignation that there really wasn't anything that could be done to help, or that they'd sought help and nothing really worked. So, but we know, and that's why we're all here today, that that's not the case, and there's lots we can do to improve matters. So, in thinking about how to manage incontinence, it's good to think about the different types of incontinence. So then we can think of the contributing factors that are causing it and make a plan to treat those factors. So, urgency urge incontinence is where people describe having to rush to the bathroom and not making it there in time. And this is the most common type of incontinence in older adults, followed by stress urinary incontinence. So that's where you're losing urine with some physical effort, like laughing or sneezing or coughing. And then mixed urinary incontinence is also very common too. And that's where people are having both those urge and the stress loss of urine as well. Overflow, you'll find, is less common, and that's when urine is leaking in the presence of a very full bladder. And then finally, functional incontinence. This is more about the inability physically to get to the bathroom in time, either related to a physical impairment or a cognitive impairment where the person might not be aware that their bladder is full or that urine is passing. So, to determine what type of incontinence a person is experiencing, best practice guidelines suggest to start with a focused assessment. So here, I have a link for this later in the slide deck. It's the Registered Nurses Association of Ontario, their best practice guideline, and they have a lot of examples in the appendices, so you can kind of go over this in detail if you like at another time. But really, when we're doing this assessment, we want to ask directly about incontinence, ask the older adults that we care for if they're experiencing incontinence. I did put a little asterisk here because I have found in my practice, people are often so relieved that someone asked and was interested in supporting them in managing their incontinence. But for some people, around disclosure, where they can talk about it depends. So, for example, someone might not want to share this in front of their child. As part of the assessment, I think it's also really important to think about what the person's goals are, and it'll be different for everybody. It might be they want to get up less at night to go to the bathroom, or they need to manage leaks during exercise. And then if the person has a care partner, a family, or a friend that's involved, it's really helpful to involve them in the assessment as well if the older adult is agreeable, because they might be involved in some of the strategies to help, such as assistance with toileting. And here's kind of the big laundry list of things that we're thinking about when doing an assessment. And this is all detailed in that best practice guideline that's freely available online. Regarding onset, I think it's when we're working in all the different settings that you're all from, it's important to figure out how long ago the problem started and if it's gotten worse in the setting where we are. I want to mention this because we are broadcasting partially out of St. Peter's in Hamilton, that we did a study where we looked at all of the standardized assessments in complex care patients in facilities like St. Peter's, and found that about 1/3 of people who had any level of incontinence when they were admitted about the third of them were more continent at follow-up. So they gained some continence during their stay. But then there was 37% of people who developed new incontinence during their stay. So I think it's important to think about what's going on in our setting and what we can do to help. So when we're asking people to kind of give a history of what's going on, we'll want to know about what's happening during the day and the night, what's causing them to lose urine. Is it stress loss or more urgency? Are they aware of urine passing? And then there's some red flags here where if people are having any pain with emptying their bladder or blood in the urine, that would be something as a nurse I would immediately flag to their primary care provider. And as part of the assessment too, it's good to see how people are able to move around and access the bathroom, and if it is anything in the environment that might be a barrier. Looking at their medications as well, and thinking about any other medical conditions that might need some optimization that may be contributing to the incontinence. Commonly, we see incontinence in persons that have Parkinson's disease or diabetes or dementia, or in men after issues with their prostate. As part of the assessment too, I would suggest making sure that someone can empty their bladder, and this would be by measuring how much they're able to void, the pre-void, and then a post-void residual, ideally with a bladder ultrasound if you have one available to you in your practice. People can also complete a voiding record, like a diary, and there's some examples of that in the best practice guideline I mentioned, where they can jot down how often they're going, when they're having accidents, and what types and amounts of fluid that they are drinking. And I think because of the risk to skin breakdown, it's always a good idea to have a look at the perineum. So then based on the assessment, you'll get some sense of the factors that may be causing incontinence, and then we can work on a treatment or a management plan. As a nurse, my practice was always supporting older adults with conservative management strategies. And then, of course, when things were beyond my scope, connecting them with their primary care provider for specialist involvement where necessary. So I'm really just focusing on the conservative side of treatment today. So these are kind of the three kind of buckets or areas of strategies that can help. Lifestyle modification. So these would be things that the person would do themselves, looking at fluid intake changes, physical activity, treating and managing constipation, which can in turn affect urinary incontinence, thinking about weight loss, and smoking cessation. Then there's kind of things around functional training piece that might be factors for your clients. Any training around gait or transferring or stairs or mobility so they can get to the bathroom quicker and more safely. Pelvic floor muscle exercises, there's strong evidence to support if you have a weak pelvic floor, pardon me, especially in women, that doing these exercises can strengthen and improve your continence. And then there's some strategies around kind of scheduled voiding or toileting regimens. This would be timed voiding, which is going to the washroom kind of by the clock ahead of a potential accident, or prompted voiding, where for someone living with dementia, we figure out when they tend to have accidents and prompt them to go to the bathroom prior to that. And then more often than not, I'd say we're doing what is called combination therapy in the literature, and that's using a number of different strategies to target the different issues that may be impacting the person's continence. So in terms of the best practice guidelines and the research evidence behind them, it's pretty mixed when it comes to older adults. And by mixed, I mean we have some evidence that says certain strategies really work, and then we have other evidence that says no, they don't work. So that makes it a bit tricky when we're trying to recommend the best thing. But I think really why it's mixed is because of the individualized nature of what might be causing the incontinence. And as you could see from our previous slides, it can be a number of different things. So it's really hard to test what combination works, as I think we really need to build the package of strategies that work for the individual. But based on this, what we know is that modifying lifestyle factors they likely work in promoting continence. Functional training, those strategies along with prompted voiding are recommended, particularly for persons that are in a more supportive care environment, like long-term care, if they are ambulatory. And there's strong evidence for physical activity in promoting continence across all ages. So likely this kind of tailored multi-component management strategy is the way to go. So based on that kind of research evidence and expert opinion that contribute to the guidelines that I've been referencing today and my own practice, here's my best advice. I think talking to people about increasing their water intake gradually can be really helpful, as more concentrated urine tends to be more irritating to the bladder and making people have the urge to go more often. Reducing caffeine intake can help, because caffeine can, again, irritate the bladder if we're looking at more than 1 to 2 cups a day, causing people to go to the washroom more often. Performing pelvic floor muscle exercises for people who are able. And then anything we can do to optimize functional abilities. So talking about physical activity, figuring out what some barriers might be to independent toileting, offering toileting support, and providing that prompted voiding or reminders about voiding for people with cognitive impairment. And again, like a lot of or all of the work that we do in supporting older adults, it really takes a team approach here. So I'd encourage you to connect with each other, your occupational therapists, your physiotherapists. We're all in it together and thinking about how to promote continence. And they can, occupational therapy, for example, especially in home and community care, I found they had excellent ideas to address some of the barriers to independent toileting. I think addressing polypharmacy, or actually really doing a detailed assessment of a person's medications, it is very important for promoting continence. And I call on the pharmacists for support here. And in the community, the Med Check program is a great way to identify what medications could be optimized, because there's a lot of medications that can affect continence. So there's some medications that make us go more often. That would be like furosemide or a diuretic, also lithium. Then there's medications that can contribute to urinary retention, like anticholinergic types of medications. And then there are medications that affect cognition, which can affect our awareness of our bladder filling or of the need to go to the bathroom, like benzodiazepines. And also, I think while we're working on promoting continence, or if we're in a situation where we cannot resolve the incontinence because of complex issues, then it's great to advise people on the right product. And not all products are created equally, I have to say. And what you see at the grocery store and the pharmacy is only kind of the tip of the iceberg in terms of what's available. So I would suggest, if you have a home health store in your neighborhood, the staff there can give great advice about what might work best, given the amount of urine that is leaking, or if you need a product that works better overnight time, or to protect your bedding. So they're an excellent resource. I wanted to point you to a few more resources that might be helpful in your practice. In terms of products again, there's this Continence Product Advisor website, which is a collaboration with the International Continence Society, and it has a lot of information around incontinence and what it is and how to prevent it and how to manage it. But it also has detailed information about all sorts of different types of pads and products. So that's a great resource, and it's designed to be older adult or patient facing. But there's lots of great resources for healthcare professionals there as well. Here is the link to the Registered Nurses Association of Ontario, the proactive approach to bladder and bowel management. Continence Health Australia, I included this because they have educational materials translated into a number of different languages, which are really helpful to share with people where English is not their first language. And the International Continence Consultation on Incontinence, is one of the guidelines that I heavily relied on for this presentation. And then finally, if you're in Ontario and you're looking for local support, if you go to 211 Ontario and put in the city you live in and put in incontinence, it helps you identify some local programs. Also, depending where you are in the province, Ontario Health at Home or Home Care, they do have nurses that are specialized in incontinence that can see you in your home. So just to conclude, before we have a chance for discussion, I think these would be my key messages: to ask about incontinence and consider the impact that it is having on the people that you care for and support. Figure out those contributing factors and call on your team to work out a plan to help manage the incontinence. And always refer and support for more specialized care if the conservative management strategies aren't working. That's kind of itsy bitsy font, my apologies, but these are the references I used to prepare the presentation today. And thank you so much, and thanks for attending. And here's my email address if you wanted to reach out after the presentation.
Thank you so much, Dr. Northwood, for that fantastic presentation with so many practical tips. Scanning through the list of attendees, I see colleagues from Specialized Geriatric Services, Behavioral Supports, our local Alzheimer's societies. So thanks everyone for joining. And again, just to remind you, please do use the Q&A function at the bottom of your screen to post any questions. We have our first question, Dr. Northwood. Are the goals of no continence or dry all the time realistic for older adults?
That's a great question. I'm going to say it depends. That's what I say to my students, and they hate that. But I think it really depends on a number of factors. Certainly, if someone doesn't have the awareness that their bladder is filling or an awareness that they're leaking cognitively, then the chances of promoting continence will be very small. So that's more about comfort and management, I would say, through products. I think if someone is aware and they notice the leaking, they have some potential to improve in their mobility, you can try out some simple interventions and see if they work. I have had people say to me, I want to be completely dry. And I've had to say, you know what, like if you couldn't be completely dry, where do you think, what would be the next best thing? Because sometimes we do have to recalibrate those goals. That's a tough one.
Thank you so much. Sarah asks, when would you refer to a specialist for more intervention or medical treatment?
Yeah, that's another great question. So it depends again. So certainly if someone is having pain with voiding, if they're having blood in their urine immediately. In my role as a nurse continence advisor, if I noticed other things were going on, for example, if someone was having like not being able to empty their bladder, then that can escalate to more of a medical emergency for a man that may have an undiagnosed prostate condition. And then in women, certainly if they have, we didn't talk about this because it's just not enough time, but if they have any kind of pelvic organ prolapse where the bladder is dropping down, then that would be a situation where you might want to consult with a urogynecologist or a gynecologist. And I think if people are have neurological conditions where you're not quite sure what's going on with the bladder, like multiple sclerosis, sometimes they can have urgency and sometimes they can be in retention, and that you might want an assessment from a urologist in that situation.
Wonderful. Thank you. Elizabeth asks, for urinary incontinence, what would be recommended timing for scheduled toileting?
That's another great question. So just kind of going by the clock or going every 2 hours is not recommended. So again, this is supposed to be tailored to the person. I find for you kind of have to figure out when they're having leaking or accidents, and sometimes the bladder diary can be a help. And if someone can complete the bladder diary, then it gives you some insight into their cognitive ability to do some of the things that you're suggesting. And then you could kind of build it around, well, it looks like you have an accident after lunch or right after you get up, and then you can build the times and try them out in that way.
Thank you. Santa asks, where can community providers access or refer to nurse continence advisors?
Yeah, that's a really good question. We do not, to my knowledge, in the Hamilton area have standalone nurse continence advisor clinics anymore, unfortunately. But if you live in the Mississauga area, the Trillium Health Partners has both outreach and clinic nurse continence advisors. There are still some remaining in home care, as well as nurses specialized in wound ostomy and continence nursing. They're called NSPOCs. So there are people out there that have an interest in that additional educational preparation. So I would try Ontario Health at Home. Home care could be an option. And then that 211 Ontario, you could see if there are nursing clinics in your area as well.
Thank you. Certainly, we want to make a connection to that important resource for the patients who need it.
Oh, I just thought of something else. Sorry. The Urology Resource Center in Burlington, I noticed that they have a or I don't know if she's a nurse continence advisor or the nurse specialized in wound ostomy and continence care, but they have a nurse there as well that's available.
Wonderful. Another attendee asks, are there any products for older women that you would recommend over others based on your practice? And also if you could speak to financial aid or any tips and tricks for accessing products.
Those are great questions. I think it really depends on a lot of things in selecting the right product, and mostly it's around the amount of urine loss and the comfort, and then the person's dexterity, because there's kind of just pads that can go in underwear that can absorb a lot of urine. Then you can go into like a full pull-on underwear to washable underwear to like a larger pad and pant system. So I think kind of seeing what the person is experiencing and then tapping into the home health stores. There's also, and this is, they don't pay me, but there's an online service called Health Wick, WICK, and you can call them and describe what's going on, and they will send you, I think it was $10, but they would send you 5 products to test out. And when I was in a pickle in the community, I would often call them and say, here's what's going on. This is what I've tried. None of it is working. What would you recommend? So that's a great way to go. And now I forget the second part of your question. I'm so sorry.
The financial piece.
Oh, right, the finances. Yeah, this is a huge issue. There is no universal funding for incontinence products. If your person you're supporting is on Ontario Disability Support Program, you can go through a process there to get coverage for incontinence products. We do have some funding through the city of Hamilton, but it's based on means, and you have to provide so much documentation around income, which can be challenging for some people. There are places like Oh gosh, it's just gone right from my head. The Cancer Support Assistance Program, if the incontinence is related to cancer in some way, they have an incontinence product support program as well. Um, yeah, so there's no other way really to go about it. It's a
Thank you.
need we should advocate for.
Absolutely. Absolutely. We're on board with that at the RGP. But that does bring us to the end of our time for today. So, on behalf of all of our attendees, thank you so much, Dr. Northwood. Thank you to everyone who joined today. Please do take a few moments to let us know what you'd like to see and hear next time by completing the survey that will appear in your email box. And we wish everyone a wonderful afternoon. Thank you.
Thanks so much.